I'm Dr. Allison Milner. I am a social epidemiologist and I work at the Centre for Health Equity, and the unit I sit in is Gender and Women's Health at the University of Melbourne, and I'm also one of the 3 Victorian Research Medical Fellowship recipients. My research sort of spans across a few different areas. Primarily it's focused on employment, the benefits of employment. I have a pretty strong focus on men at work, also on disability. So people with disabilities and how they can or cannot benefit from different types of working arrangements. I try and do etiological work, which is analysis with big data sets, to try and understand and unpack how employment might influence health, but also I do stuff on the ground, so specifically with prevention community groups that are trying to improve employment circumstances for people. The relationship between gender and mental health is actually a really complex one. Across the Australian population, like across many populations in the world, there is gendered segregation into different occupations. So you find that men are more likely to go into very physical jobs, they're more likely to go into very high-powered jobs, management jobs, whereas women are much more likely to go into service-related jobs or become health professionals, become teachers. So that's one thing that's fascinating in and of itself. And we know that each job has its own inherent mental health risks. You might be able to be really, really highly creative in a job, but then it might also be really, really demanding. And then when you look at something like mental health, we know that men in particular are much more likely, and this has been shown over centuries of sociological work, to be influenced by external economic factors that are around them. And that really hasn't shifted despite the first research in this area being like 200 years ago. We still see men still being very, very influenced by this idea of being the breadwinner, being dominant at work, and these sorts of ideas. So my own work has increasingly become focused on that. You take an occupation like nursing. Nursing's very highly female dominated, and we know that both men and women have high rates of suicide in that job. You take being a medical doctor. It's male dominated, not so much female dominated. But what you see is the female doctors have high risk of suicide, but not male doctors. As far as we can understand, that's something about the context in which people are working. We know that female doctors have often spoken about that environment being very masculine, and it's being very difficult for them to work long term, particularly after they have a family. Nursing, you might have the opposite problem. So why are men at risk at nursing? Our current understanding at the moment is that it might be connected to both the stresses that are in that job, so how much control people have over the work, their long hours, whether they're working shift work, all these things we already know are harmful for health, but might also be connected to how gender norms are constructed within that workplace. The other sort of thing that we know too is that access to means is a huge risk factor for suicide. So both male nurses and female nurses have access to drugs, for example, that they can use to end their life. Similar with female and male doctors. Interestingly, that the male doctors don't have an elevated rate, even though they've got the same access. So even though it's a risk, I don't think it's the whole explanation for why there is elevated rates of suicide within specific occupational groups. And then if you switch across, you flip it over to somewhere like construction, which have the highest rates of suicide in Australia, as in many other countries of the world. They don't have any greater ability to access lethal means to suicide than, say, the medical profession, but they have much higher risk. We do think that that is primarily connected to the pressures that construction workers are placed under. The environment they work in can be very insecure. One of the first things that's hit in an economic recession is usually the construction industry in terms of housing building, build approval and things like that. We also know that the environment they're working in terms of how supportive people are around them, how demanding the job is, the work hours is also problematic for construction workers. Men who strongly adhere to male norms like these traditional male norms about masculinity are less likely to seek help. So they may feel as though they need to be more self-reliant, they may feel as though work is really, really important to them. So men adhere to those more are least likely to seek help and may be at greater risk of mental health problems. I think that wherever you are, that there is some universality in terms of risk factors. We do see very similar patterns of distress by occupation across different areas of the world, which says to me, yes, it's a universal thing, and I believe those are connected to some of these fundamental determinants of health that are preventable. So things like how good the work is that you're doing, that's pretty fundamental to everyone. Things like work that's free of bullying, income, education, these are all fundamental determinants of health that we can actually intervene on. So that's like from a health inequalities perspective, I have sort of focused on one area in which I believe that we can make real gains, and that is employment. We know this is related to people's health, both in the short term and as they get older. A variety of health conditions, it's not just mental health, it's physical health, chronic health, everything. So if you can make some gains there, then you have the opportunity to really improve somebody's life. We also need to understand whether these things are working from an economic perspective, because programs are expensive to roll out, and I think we have an obligation to say that whether these are cost effective or not. The other thing that I think is fundamental that I would really like to see changed in my lifetime is greater attention to the quality of the work that people are doing. So the amount of control they're having, how well they're treated at work, the amount of support they have around them, how secure their work is. All of this stuff we know are fundamental causes of people's general health, and they should be something that employers, governments, policymakers can actually intervene to make better.